Well, hey there, pharmacy owners. Dr. Lisa Faast here from DiversifyRx. And I got a great question from Tom today. So I thought I would do a little video to not only answer for Tom, but for any of you other pharmacy owners that have questions about 90-day contracts for your insurances and whether you should do 90-day, not 90-day. We're going to discuss that. So whether you even have a choice of accepting or declining a 90-day might depend on if you're using a PSAO or you're going direct. And if you are using a PSAO, which PSAO? Some PSAOs might not let you decide which networks to join or not join, depending on their agreements with the various PBMs. Other PSAOs, you might have a choice. You could accept the 30-day network and decline the 90-day network. And of course, when you go direct, that gives you the greatest flexibility for your pharmacy in determining what contracts you accept, what networks you accept, or which ones you decline. It is why I am inherently biased towards direct contracting. Yes, some of the contracts can actually be better direct, but ultimately, it gives you more control. And in this day and age, in 2025, as a pharmacy owner, one of your greatest advantages for having a successful, thriving, continuously profitable pharmacy is having control over as many aspects of your business as you can. There's so much that is out of our control that you've got to take control of the things that you can. So, question, he's opening a new pharmacy. So whether you're opening a new pharmacy, maybe you're changing PSAOs or considering going direct or doing anything different with your contracts, this video will be for you. So he's considering what contracts to sign or not sign, and we had a little conversation about the benefits, the pluses and minuses of that. So really quick, 90-day contracts, they're available on both commercial networks and Medicare networks. All right. And what that does is it allows you to fill 90 days supplies of medication for your patients. Now, for the benefit of doing that, you are going to be paid less. All right. Not just in dispensing fees. I mean, God, some of those 90-day contracts have $0 dispensing fees because, you suddenly deserve to make no money because you decide to fill for 90 days. But it's also lower reimbursement per unit of the pill. So it doesn't matter if it's a MAC price basing, AWP pricing basing, you will get paid less per unit on a 90-day contract than you will with a 30-day contract. Doesn't matter if it's Medicare or commercial. Now, I will say on the Medicare side, certainly with brands are pretty much a loser on Medicare. You will get reimbursed below your cost, whether it's a 30-day or 90-day, but 90 days are atrocious. Like you will go bankrupt if you fill brands on 90-day for Medicare. I do not recommend doing that. On the generic side, is it profitable on the generic side? It's hard to answer that because it really depends on how you're buying your generics. This is both for commercial and Medicare. If you're buying your generics through, I would say, typically primary vendor agreement, primary wholesaler agreement, where you're basically overpaying for your generics in order to get falsely lower brand costs, a lot of those generic 90-day terms are not going to be profitable because, again, you're overpaying for generics. However, if you buy your generics from Real Value Products or JamsRx or EsriRx Marketplace or Blue Packs or FarmSource or any of the plethora of secondary wholesalers out there that are net pricing wholesalers, a lot of those generics you can actually make money on. Like that's where the profit in pharmacy is and is on a lot of those generics. So back to the question of what should you do about a 90-day contract? If you just want to avoid and be able to say I can't fill 90 days and you have the choice, you can just decline all those networks. Again, if you have the choice, depending on your PSAO, you may not have that choice. Other pharmacies, I say, you know what, you can sign that and just try not to promote it, try not to do it. Maybe you have that one, patient that you do it for, something like that, and it's available there if you need it. Frankly, for a lot of the generics for 90 days, if a patient really, really wants 90 days, I'll probably try to convert them to a more cash-based extended supply program, like the whole bottle 100-day supplies or even 6-month supplies, something like that. So there's always ways to give the patient what they need and to serve the patient no matter what your PBM contracts are. So there's always flexibility there. But to answer if they're profitable, 90-day contracts will always make you less money. Always. The other thing that they do is if you put all your patients on 90-day contracts, there's a couple of things that happen. One, you kind of lose that tightness relationship with them. You know, one of the benefits that we have as brick and mortar independent pharmacy owners is we get to see our patients every month, sometimes multiple times a month. And so that actually helps build repertoire, it builds a relationship. You keep better in touch with them. You know what's going on in their life. They know what's going on in the pharmacy. So there's a certain part of that patient relationship aspect that you kind of lose when you convert them only to seeing them once every 90 days. The other thing that happens is you lose the opportunity to sell them stuff, other stuff, whenever they come into the pharmacy. People need stuff all the time. They run out of, ibuprofen. They need cough medicine. They, need more toothpaste. They looking for a supplement for weight loss, all these kinds of things. And if they're coming into your pharmacy regularly, you kind of become that default place that they pick those items up. But if they're only coming into your pharmacy every 90 days, they start to look for another alternative. They'll go to Amazon. They'll go to, DoorDash or whatever delivery service or whatever convenience stores on their way home. And so you lose that ability to really tap into your full patient database on a regular basis for those OTC sales that are so critical for not only helping your patients meet their health goals and their health needs, but also for your cash revenue and cash flow and profitability. So in general, there's really no upside to a 90-day contract. There's really no, oh my gosh, you're going to get all this new business because you signed a 90-day contract. There's a whole lot of downside. So it's kind of up to you what you decide for your business, but that's kind of how I dissect it and look at it, that you can always meet patients where they need. There's always ways to serve the patient, regardless of a PBM contract. You can follow the guidelines of the PBM contract and you can serve the patient. There's always ways to do that. We actually talk about that in our Cash RX support calls inside our membership. So there's always ways to serve the patient. It's just kind of a matter of like what you want to be held accountable for to having to bill for that. So hopefully that was helpful for you. If you have any questions, feel free to pop them down below wherever you're watching this video. Happy to answer them. And if you're interested in kicking ass in 2025, I'd love to let you learn about our GSD Accelerator program or even full Pharmacy Badass University membership. So we're here to help you, and I am so hopeful for 2025. Happy to be gone with 2024, ready to kick some butt and go on the offense in 2025. And I hope you're ready for what could be a very busy and very profitable year. So until next time, bye-bye.